Assalamu alaikum. So today's our topic is posterior triangle of the neck. Okay, as we have discussed the anterior triangle, similarly we have the posterior triangle, which is divided by the clitomastoid muscle, and here is the posterior triangle. It also has subdivisions, which is subdivided by the small muscle, is inferior belly of the omohyoid muscle. Okay, so where it is located, it's on lateral aspect of the neck and in direct continuity with upper lip. And its boundaries are anteriorly posterior edge of the sternocleidomastoid muscle, posteriorly anterior edge of the trapezius muscle, base, middle one-third of the clavicle, apex, occipital bone, just posterior to the mastoid process, where the attachments of the trapezius and sternocleidomastoid come together. Group cervical fascia, floor, prevertebral layer of cervical fascia. Splenius capitis, levator scapulae, and the posterior middle and anterior scalene muscle. Okay, so we have subdivisions. It is subdivided by the inferior belly of omohyoid muscle. The lower part is the occipital triangle. The large upper part is the occipital triangle, and the small lower part is the supraclavicular or subclavian triangle. So this is all the posterior triangle, and it is subdivided by the small muscle, which is the omohyoid muscle, and it divides the upper larger part and the lower small part. So the upper larger part from here till here, it is the occipital triangle, and this small part is the subclavian triangle or supraclavicular triangle. Okay, so these are the contents of the occipital triangle, uh, in which the nerves passes are spinal accessory nerve, fourth cutaneous branch of cervical plexus, lesser occipital greater auricular, anterior cutaneous nerve of neck, supraclavicular nerve, and the muscular branches are two small branches to the levator scapulae, two small branches to the trapezius nerve to rhomboids, C5, C6 roots of the brachial plexus, transverse cervical artery and vein, occipital artery, lymph nodes along the posterior border of the sternocleidomastoid, more in the lower part, the supraclavicular nodes, and a few at the upper angle, the occipital nodes. So subclavian, we have three trunks of brachial plexus, nerve to serratus anterior, nerve to subclavius, and suprascapular nerve. And the vessels pass at the third part of subclavian artery and subclavian vein, suprascapular artery and vein, commencement of transverse cervical artery, and termination of the corresponding vein, lower part of external jugular vein. And the lymph nodes, few members of supraclavicular chain. Thank you.